Cholelithiasis or gallstone disease is quite uncommon in pediatric population, but recently many cases are diagnosed in children and adolescents. Gallstone in Indian pediatric population are not discussed vividly in studies. Now we learn about the pathophysiology of cholelithiasis in pediatric patients. First, the predisposing factors are female genetics, ABC before gene defect, prematurity, hemolytic disease, and precipitating factor childhood obesity, TPN, prolonged fasting, or fusemide therapy. There are three types of stone seen in cholelithiasis. First, the cholesterol stone. 80% cases are seen this type of stone. The abnormal cholesterol metabolism, and due to this the hypersaturated bile occurs and increase the cholesterol level and decrease the bile salt and decrease the lecithin, and due to this the cholesterol stone occurs. Next, the black pigment stone, which is 10% cases. There are the hemolysis occurs and increase the unconjugated bilirubin, and due to this the calcium bilirubinate occur and black pigment stone occurs in these cases. Next, the mixed brown pigment stone, which is 10% cases. The biliary infection or infestation. Due to this, the increase the beta glucuronide gauge, and due to this, there are the increase the unconjugated bilirubin and calcium bilirubinate, and due to this, the mixed brown pigment stone occurs. Then, the supersaturated bile with cholesterol and calcium, and precipitation of solute from solution as solid crystals, and crystals clump together and form stones, and gallstone occurs, which is known as the cholelithiasis, and due to this the gallbladder contracts after intake of fat to release the bile, and lumen is obstructed by the stones. And due to this, the gallbladder contracts after the intake of fat to release the bile. There are upon the contraction, a stone is moved and become impacted on the cystic duct, and cholecystolithiasis occurs. And due to this, the cholecystolithiasis, there are also the lumen is obstructed by stones. Due to the lumen is obstructed by the stones, there are the bile stasis occurs. The chemical reaction inside the gallbladder triggers the release of inflammatory enzymes, which is prostaglandin. And due to this, there are two conditions occurs. One is the fluid leak into gallbladder and edema occurs. Increase the intraluminal pressure and distension of gallbladder and constriction of blood vessels, and due to this the acute cholecystitis occurs, and also the inflammation of the gallbladder, and due to this the biliary colic seen, and Murphy's sign. Murphy's sign means there are the pain in right upper quadrant region, and acute cholecystitis occur. And due to this, if treated or if not treated, if treated the child, then the surgery with proper diet, low fat or high fiber diet, the compliance to medication, then the good prognosis seen. And if not treated, then lack of blood supply, there are necrosis occurs, and then the gangrene and empyema and perforation of the gallbladder. And if not treated, then also the intraluminal pressure are increased, and rupture of the gallbladder, and spread of bile and indigenous microorganism into the peritoneum, and the perforation of the gallbladder. This is also causes the spread of the bile and indigenous microorganism into the peritoneum. Then the sepsis occurs, and if the child is not treated, and ultimately death seen in the child.